ჩვენი პროექტი შეეხება გლობალური ჯანდაცვის დარგში პროფესიული სწავლების ხარისხის გაუმჯობესებას. გლობალური ჯანდაცვა არის ძალიან სწრაფად მზარდი დარგი. გლობალურ ჯანდაცვაში არ არის დღეს შესაძლებლობა ეგრეთ წოდებული გამოცდილებაზე დაფუძნებული სწავლების მეთოდის გამოყენებისა. მაგალითად, კლინიკურ მედიცინაში ეს მეთოდი გამოიყენება ჩვენ როგორც ვიცით, სამედიცინო ინსტიტუტის სტუდენტები მხოლოდ 2 წელს ატარებენ საკლასო ოთახებში, შემდეგ ისინი გადადიან საუნივერსიტეტო ჰოსპიტალებში, სადაც ისინი პრაქტიკულ უნარჩვენებს გამომუშავებენ. ბუნებრივად ჩვენ არ გვაქვს საშუალება გლობალური ჯანდაცვის სტუდენტები გაუშვათ იმ საველე პირობებში, სადაც გლობალური ჯანდაცვის პრაქტიკა ხდება. ამიტომ ჩვენ ვირტუალური ტექნოლოგიის გამოყენებით გვინდა საველე პირობები მოვიტანოთ საკლასო ოთახში და გლობალური ჯანდაცვის სტუდენტებს საშუალება მივცეთ თეორიული ცოდნის შეძენასთან ერთად გამომუშავონ ის პრაქტიკული უნარჩვევები, რაც მათ აუცილებლად სჭირდებათ. დღევანდელი შეხვედრიდან ჩვენ ველოდებით დაფინანსების მიღებას პროტოტიპის შესამუშავებლად. პროტოტიპში გამოყენებული იქნება ებოლას ეპიდემიის კონტროლი აფრიკაში. ეს იქნება ძალიანად სიმულირებული გარემო, სადაც სტუდენტს ექნება საშუალება ჩაერთოს ფიზიკურად და განახორციელოს პრაქტიკული ქმედებები, ისეთი როგორიც არის პაციენტის გასიჯვა, პაციენტების ევაკუაცია და ასე შემდეგ. ეს კიდევ ერთხელ ვიმეორებ, ხელს შეუწყობს მნიშვნელოვნად გააუმჯობესოს სწავლების ხარისხი. This is not the first time I'm presenting, but certainly the first time with the makeup on my face, so it's quite an experience.
You look beautiful. Well done.
Very good. So thank you for the opportunity to present our innovative solutions that we think can significantly improve the quality of professional training programs for global health. Global health is a very rapidly growing area. It deals with challenges that affect health of large masses of population around the world. You see a few examples on the screen. And for the last 10 to 15 years, there has been a very rapid proliferation of university training programs in global health to scale up the global health workforce. But there is a problem. The problem is that multiple evaluations of the educational programs indicate that global health programs lack the so-called experiential learning component, which means that the students do not have the opportunity to gain practical skills. Graduates have good level of theoretical knowledge, but they do not have practical skills that are necessary for effective performance in the field. This is experiential learning. It's widely used in many areas, including, for example, in clinical medicine. Medical students spend first 2 years in classrooms, then they move to teaching hospitals where they work under supervision with patients. Obviously, for global health, we do not have the opportunity to send students to the field. Therefore, global health training is largely a theoretical exercise, which explains the problem. So we would like to offer a solution. Since we cannot send students to the field, we would like to bring the field to the classroom by using virtual reality technology. We are requesting 90,000 laris to develop and to test a prototype training course, which will be based on controlling the Ebola epidemic outbreak in Africa. This will be a fully immersive and fully interactive environment which will simulate users' physical presence, and students will be able to perform various tasks. For example, examining patients, evacuating patients, spraying disinfectants, and so forth. But this is not a video game, right? This will be a professional training program which will be rich of technical content to ensure effective knowledge transfer. Quite a few things have been already done. We validated the concept. We spoke with a lot of global health academic community members. We spoke with a lot of VR content developers. They all encouraged us to pursue. They thought this was a good idea. We have agreement with universities where we will test the prototype to get users' feedback. We have a full script which incorporates various pedagogical methods. We secured co-funding, and importantly, we have access to larger funding which will allow us to develop the full course out of the prototype. All those donors require that the prototype should be already available. So we are requesting for this funding to develop the prototype to gain access to the larger funding. So there is quite a bit of competition. Potentially universities where global health is taught can be competitors, but we are going to convert them into our partners because they do not have experiential learning components. So we are going to offer them our product which will help them to improve their service. VR industry can be also a competitor, but none of them have global health expertise, which we offer. And there are some products on the market based on VR which provide educational content, but none of them actually give training for global health. So we have a number of advantages. To summarize those multiple bullet points, we feel that we are the right people at the right time and at the right place to pursue a project like this. So our business model, we are developing a product which will be VR-based global health training course. We will offer our product to service providers, which are universities and non-university training providers, and we will charge fees for that. Distribution is global. Our customers are universities, but also UN organizations, ministries of health, NGOs. There are about 50,000 people every year who take global health courses. We have 3 scenarios for revenue generation. You can see it on the next slide. Our TAM is estimated around $47.5 million. We are going to target primarily North America, Europe, China, and India, which is about half of the market. Why these regions? Because we know them, they know us. I've been working with those universities for over 15 years. There is trust, so it will be easier to enter these markets. We have 20, 30, and 40% coverage scenarios, which will generate between $1.5 and $3 million per year. This is not an overnight money-making machine. There is patience that is needed to reach the market from today until the full product is available for market. The time is estimated around 2.5 years. There are several milestones, as you can see, and we have a very thorough marketing plan. We have access to all those events and conferences and technical journals and other things that are listed on the screen, and we are going to implement the marketing strategy. And this is my last slide. We have an international consortium. Cumulatively, we bring around 40 years of experience, and we have all the skills that are required for a project such as this, including management and entrepreneurship, global health and academic experience, and also virtual reality content development and producing. Thank you for your attention. Since we have a few more minutes, let me take you to one more slide where we show annual distribution of the revenue projection. As you can see, with the medium and with the optimistic scenarios, we will reach the break even at the first year. And in case of the modest revenue generation, the break even will be reached at the second year. Thank you very much. Happy to take your questions.
The development time, I mean, this is almost June 2018, and you said you were going to take it to a conference in February 2019, but you haven't started building it yet. So is this an interactive experience, or is this like just immersive, where you just have some video that you generate a 3D image and you put somebody in the not operating room, but in the medical facility to sort of observe?
Right. Yes. So we will start developing the prototype with this funding. Prototype development will take, and testing will take around 6 to 7 months. There will be several conferences where we can take the prototype, not the full product. So we will test the prototype.
So what does the prototype do? Is it interactive or not?
Oh yes, it is fully interactive, it is fully immersive. As I mentioned, prototype will be based on Ebola outbreak control, but this will be just a small portion of the full product. So Ebola outbreak, which is the prototype, will be part of the infectious diseases module. There will be 12 modules in the full product: infectious diseases, humanitarian catastrophes, bioterrorism, and so forth.
So I guess my question was, have you validated with people who have experience developing VR products that you can do it in 6 months?
Oh, absolutely. We interviewed actually 5 VR developers. We selected 1 out of 5. Before interviewing, we interviewed 5 specifically for this project, but I have been speaking with them for the last 2.5 years. I have attended around 10 VR conferences with exhibitions and expos, so I know them quite well.
Thank you. Yeah. That's good.
Global health is not a term I was familiar with. So when you pitch, and neither was Nick, so when you pitch, I figured it out when you were speaking, but at the very beginning you should say what is meant by that.
Right.
We're
Okay.
not healthcare professionals.
Sure.
And with IBM, we have a big healthcare business. I had not heard that term.
I'm happy to do that. Actually, this term is new. It appeared around 15 to 20 years ago. Before that, we used another term, which is international health. The difference between the two is that international health is largely the support from the rich countries to poor countries to address the problems of poor countries. So this is what UNICEF and Red Cross and the global health is the health issue which does not recognize political borders. The global health is a challenge that can affect any country regardless how big, how rich, how powerful they are. So for example, Ebola, which I mentioned, it started in 2014 in Sierra Leone, Liberia, and Guinea.
Yes, of course. And we understand now, and I understood after we saw these photographs, but we had not all heard that term, so just one sentence about it at the beginning of your pitch would be very helpful.
Well, address challenges that affect health. I just published a book. I'm happy to give it to you.
So I am on the board of the Duke Engineering School.
Right.
And so how does Duke, I saw that up a few times,
Right.
How would Duke be of assistance to you?
Well, Duke has one of the largest global health program. They offer a Master of Global Health. They also offer a doctoral degree. And Duke either can partner with us during the second phase when we start the full product development because they can provide a lot of global health expertise, which we probably need to have because we are experts in certain areas, but certainly not in all areas. And secondly, Duke can be our customer. When we have the full product, they can integrate the VR-based curriculum component into their global health curriculum, and they can use it for teaching. So this will be the two areas where Duke or many other universities can work with us.
So could I summarize this opportunity as one where you've built a platform for the dissemination of information through VR targeted toward global health, and you're perfecting that platform and system so that organizations that have content can distribute through that platform?
Well, content will be part of our platform. The organizations that have service, which is providing global health training, can use our platform with the content to improve the quality of their service. So this will be a head-mounted device where the application will be installed, the full content, 12 modules. So by module, they will use it.
This has been on for a while. How is VR helping? Have we found any proof that VR is more effective in
Absolutely.
some way?
There's a very rich body of literature that shows that VR-based education is between 3 and 6 times more effective than non-VR-based education, particularly in the areas where you need practical skills in addition to theoretical knowledge, which global health is.
What are you saying, Paul? Yeah, no, I know. I wanted to hear that. Anyone else? No?
Thank you very much.
Thank you. პირველ რიგში მინდა დიდი მადლობა უთხრა ტექნოლოგიების და ინოვაციების სააგენტოს. ეს პირველი შემთხვევა, როცა მე მონაწილეობ ესეთ კონკურსში საქართველოში და საკმაოდ დადებითი განწყობა მაქვს. ჩვენი პროექტის გარდა უამრავი ძალიან საინტერესო პროექტებია და ძალიან მიხარია, რომ განსაკუთრებით ახალგაზრდები არიან ესე ღრმად ჩაფლულები ინოვაციური პროექტების დიზაინში და განვითარებაში. რაც შეეხება ჩვენს პროექტს, მე ყოფილი ვარ, მე ვფიქრობ, რომ პრეზენტაციამ ნორმალურად ჩაიარა. კომისიამ გამოთქვა ინტერესი გლობალური ჯანდაცვის როგორც დარგის მიმართ, ეს მათთვის ახალი დარგი იყო, რაც არ არის გასაკვირი, იმიტომ რომ თვითონ დარგის ახალია, სულ 10-15 წელია, რაც ეს დარგი ჩამოყალიბდა. მე შევეცადე განვემარტა მათთვის თუ რა არის ეს დარგი და რა დადებით შედეგს მოიტანს ჩვენს მიერ წარმოდგენილი ინოვაცია ამ დარგის შემდგომი განვითარებისთვის. გაველოდოთ საღამოს და შედეგები გამოჩნდება.
პირველი გამარჯვებული ეს არის სტარტაპი, რომელიც ვირტუალური რეალობის ტექნოლოგიის გამოყენებით გლობალური ჯანდაცვის პროფესიულ სასწავლო პროგრამებში ახალ მეთოდოლოგიის ინტეგრაციას ახდენს. ეს არის Global Health.
მინდა პირველ რიგში ისე გავიმეორო მადლობა სააგენტოს მიმართ. ძალიან სასიამოვნოა რომ ესეთი ღონისძიება ჩატარდა. მე ვფიქრობ რომ ეს არის ძალიან სწორი გზა სახელმწიფო რესურსების ხარჯვის. რაც შეეხება ჩვენს პროექტს, ჩვენ ახლა გავაკეთებთ პროტოტიპს, რომელიც გულისხმობს გლობალური ჯანდაცვის დარგში სასწავლო პროგრამების ხარისხის გაუმჯობესებას ვირტუალური რეალობის ტექნოლოგიების გამოყენებით. ეს დაეხმარება მსოფლიოს წამყვან უნივერსიტეტებს მოახდინონ ინტეგრაცია თავიანთ სასწავლო კურიკულუმებში აი ამ ახალი ტექნოლოგიის. მე იმედი მაქვს, რომ ეს გრანტი არ არის ერთჯერადი ინტერაქცია ამ სააგენტოსთან და იმედი მაქვს, რომ ეს არის პროდუქტიული თანამშრომლობის დასაწყისი და მოუთმენთ თბილი მასთან თანამშრომლობას.